The Kenya Union of Clinical Officers is now taking a stand against what it calls organized corruption by the Social Health Authority Board. The union is accusing SHA of forcing clinical officers to register with the Kenya Medical Practitioners and Dentists Council in order to offer services even though clinical officers are already regulated by another body.
In this case, when now they force current clinical officers who are already registered under the Clinical Officers Council to go and take another licensing from, or rather register under KMPDU, it is a double registration and pushing more cost to clinical officers. And we feel that that's not geared toward easing of business and also service delivery.
KUCO argues that the new policy would force clinical officers to seek pre-authorization from KMPDU to perform basic procedures, creating unnecessary challenges that could slow down service delivery.
It's becoming difficult to keep calling a doctor requesting for their credentials or to ask them to come and fill their license number, registration number and sign and go. And yet I'm the one who has attended to the patient, I'm the one who has done the procedures.
As a result, clinicians are vowed to hold weekly protests across the country until the demands are met. They are calling for the immediate suspension of the double registration requirement, which they say is a clear attempt to extort money from healthcare providers.
For any clinical officer to be contracted, they must get a second license from the KMPDU, which is illegal, because the KMPDU Act provides that they are supposed to register facilities by medical officers and dentists. That can only be called extortion, because you are going out of the law to make a policy that is going to make somebody else suffer financial harm when they bring money to KMPDU, and we cannot say it is for anything else other than monetary gain.
They're calling to attention how the new policy contradicts President William Ruto's vision for universal health coverage, a system meant to ensure that no Kenyan is left behind. Dozens of Kenyans seeking clinical services may have to continue enduring the trouble of being turned away should the government not meet the demands by the Union of Clinical Officers. Gertrude Burgay, reporting for K24 TV.